This episode of EMS One-Stop is brought to you by Lexipol, the experts in policy, training, wellness support and grants assistance for first responders and government leaders. To learn more, visit lexipol.com. That's Lexipol.com. Hello and welcome to EMS One-Stop. I'm your host, Rob Lawrence, and it's First Responder Wellness Week. And it's one of those weeks, in fact, it should be every week, where we think about looking after ourselves, making sure that we are fit, healthy, happy, and ready to not only do the job, but also to actually live a life. And so I'm delighted to have a returning guest with me on EMS One-Stop, and Dr. Dan Patterson, Associate Professor of Emergency Medicine, James O. Page, Professor of Emergency Healthcare and Worker Safety from Pittsburgh. Welcome back, sir. How are you?
Good. Thanks for the opportunity.
Yeah, so one of the things, and I was saying to you before we started recording, that one of the most popular articles that I've written, as in popular, as in most read, maybe not most enjoyable, but was actually talking about what I called the EMS bedtime story, which is in terms of rest, not succumbing to fatigue, and a lot of the stuff that actually work that you've done. And also a lot of the work from the US Army Field Manual on fatigue and rest as well, which of course we need to have, soldiers and warfighters ready to do what they need to do. And obviously in the same vein, we need to have public safety officials ready to do what they do. So that's already in the show notes. Please see the link. But of course, you are an expert in this particular area. And so for those that haven't met you before, Dan, would you mind doing an introduction of who you are, where you're from, and obviously the sort of field of the field of expertise that you have, particularly in the EMS environment?
Well, first, thanks again for the opportunity. It's always great to talk about the research that we do here at the University of Pittsburgh. I'm an associate professor, as you just mentioned. I'm also a paramedic. I still practice, still work shifts. And my focus area in terms of research is on the health and wellness of clinicians, EMS clinicians. In particular, their sleep, their shift work habits, and everything related to being a shift worker.
Now, of course, that's a great introduction, but I know there's a lot more to it because I see on your social media pages you are out there all the time, working as a paramedic, but obviously that kind of aids and assists your own field of research, I'm guessing.
Absolutely. I feel very strongly that you can't investigate these problems or these challenges without knowing good and well what goes on out there in the field. So I try my best to be very much in touch with reality.
And so, in terms of your research, I mean, what are your research methods? I mean, are you getting cohorts of people to come and sleep in front of you? How are you measuring this? What is the sort of the tech, as it were, behind what you do?
Well, we do all sorts of study designs. We use observational study designs, such as surveys or looking at existing data, and that can give us sort of clues and help us generate hypotheses for looking at these issues in more detail. We also do experimental studies, whether they be in the community, where we go out in the community and randomize operations or individuals to intervention or control status for some sort of intervention, or we do lab studies. And in fact, I have a lab study underway right now where we bring in clinicians and we deprive them of sleep, similar to a shift work condition. So we simulate shift work conditions in the lab to try to figure out how they react physiologically, how their cognition is affected, and what the impact is of different interventions, such as strategic napping.
So clearly, one of the things that happens on an EMS shift is you are naturally deprived of sleep because you're always on the go when the call is coming in. But in the lab, how do you keep someone awake? How do you stimulate? Is there stimulus, or is there sort of loud noises, or you're going around shouting at them? How does it work?
Well, we have staff who basically keep the individual awake. And they know when they consent to the study, they know what to expect. They know they're going to be kept awake for a while. Sometimes we tell them that they're going to get a nap if we are testing a nap intervention. Other times we don't tell them, and we surprise them. So, but these are folks, typically our target population are individuals who either are EMS clinicians or some other healthcare worker or public safety worker who sort of know and have experienced for themselves shift work-like conditions. So, in many instances, when they do participate, it's not that much of a surprise because they sort of know that sleep deprivation and sleep loss come with the package, come with the job.
Yeah. Now, of course, and I'll get onto a number of sort of, general questions for the folk out there in EMS world, as it were, EMS land, as it were. But when you're under those laboratory conditions, I mean, how are you measuring and what are you seeing in terms of that kind of decline with as more and more and more fatigue sets in, and as your people are, keeping Rob from having a little nap because you were talking at me or whatever. I mean, what does that kind of curve look like when you're measuring someone under those conditions?
Well, we want to make the experience as low burden on the participant as much as possible. There are many things that we want to test, many tools that we have at our disposal to examine declines in cognition, performance, health, different indicators of health, but we don't obviously use all of those. Most of what I focus on are the impacts of sleep deprivation on cognition, such as reaction time, which is a very crude
Yeah.
assessment of cognition, right? It's only one. It's only one assessment. And that's an easy one to do. So we favor using tools that are lower burden on the individual. So we assess reaction time, and we do that in regular intervals, like every hour, or in rapid succession, depending on what the time point is in the protocol. We also look at a lot of cardiovascular indicators. So heart rate variability, changes in blood pressure dipping patterns. We've looked at arterial stiffness. We've looked at endothelial function. So there are numerous tools that we use to look at a lot of different cognitive, and in particular, my interest are cardiovascular outcomes. And we measure those regularly. So in many cases, hourly, in some cases more rapid, more close proximity to some sort of stimulus, for example.
And is there then an obvious diminishing return of time versus fatigue? And is there sweet spot is probably the wrong choice of phrase here, but is there a spot at which somebody becomes, you know, not useful at all in doing the job that we do?
Well, a lot of what we're seeing in our data is not new. I mean, we know
Yeah.
from many different studies involving non-shift workers, because I in particular focus on shift workers, that staying awake for long periods of time, has a negative impact on our cognition, our performance, our health. And so a lot of what we're seeing is obviously going to be not new information. It's just very specific to EMS clinicians and public safety workers. So we do see a decline. And what previous research has shown and what we see is that we are at our poorest in terms of performance in those early morning hours, the circadian night. So between 2 a.m. and 5 and 6 a.m., which is when we are normally asleep, right? Normal human physiology and circadian biology is we are awake during daylight hours, and then we are asleep at nighttime hours. So when you try to disrupt that normal circadian pattern, I don't care who you are, if you're a shift worker or a non-shift worker, it's going to have a negative effect on certain indicators, which include some of our performance indicators and also some of our health indicators. So that sort of danger zone, if you want to call it that, which is common across all humans, can be those early morning hours between like 2 a.m., 5 a.m., 6 a.m.
And so does this apply? We have the sort of classic, I'm a night shifter. I've done nothing but night shifts my entire life. Therefore, I go home, I sleep in the day, and the night is my day, and the day is my night. And I'm sure we've heard and had all of those discussions going forward. But is that the same for the night shifter? The same deal?
Well, there's literature by Dr. Hans van Doggen, for example, out of Washington State University, that clearly shows people are different, right? We have different traits. Some people are night owls, Some people are people who are very comfortable during daylight hours of being vigilant and alert. So that there are traits. We are trait level different
Mm,
from person to person. But that changes as we age. And not only does it change as we age, but repetitive exposure to those conditions over time can definitely have a negative effect. So you may today, let's say you're a 30-year-old paramedic, you may today say, you know what, I have no problems doing night shifts. I can function, et cetera, et cetera. 10 years later, that's probably not the case.
right. Can't do it.
But there are individuals who can definitely function at a high level during night shift conditions. And those individuals, I would wager pretty heavily, probably get a fair amount of sleep when they do get to the opportunity to sleep. However, having said that, we do know that individuals, many of them, they self-report high functioning with limited sleep. I would say maybe not.
I, having come to the US from the UK, actually, even though we know that fatigue is an issue here, and as I say, we have the day shifters and the night shifters, which might help a little bit in the UK, and I still sort of shake my head at that there is no day shift, night shift. It's you do 2 days, you have a swing day, and you do 2 nights, and so it goes on, and people are permanently
Mhm.
exhausted. And that's no way to run, in
Right.
my humble opinion, and I was that chief in the UK, that's no way to run a business, no way to run an operation. So it's not great here, but it's not worse than than over there. And so that's sort of I'm
Yeah.
thankful that at least we are in a day night, and also we are doing this level of research. We have some very specific questions, Dan, to talk about, how, and again, that was just me sort of geeking out on your methodology there, because I think it's important to understand how you are measuring these things. But we'll take a little break in a second, and then we'll come back and sort of talk about what are agencies, individuals, chiefs need to think about, be aware of. But let's just take a second for a quick break.
Gordon Graham here, and I'd like to take a few minutes to share some thoughts about wellness. Ladies and gentlemen, we've been talking for many years now about the importance of wellness for first responders. It's far from a secret that this job takes its toll, physically and mentally. First responders are at elevated risk for many things, not the least of which includes cardiac disease, diabetes, anxiety, depression, PTSD, and suicidal ideation. While we've seen significant improvements in how we think and talk about wellness since my days as a motorcycle cop, we know without a doubt there's still a lot of work to be done. Fortunately, agencies around this country are establishing wellness programs, working to smash the stigma around mental health and encouraging physical fitness with better access to resources and support. So let's consider what you can do to support wellness. Are you taking advantage of the resources that your agency provides? Are you encouraging your fellow first responders to do the same? How about remembering the basics? Simply taking care of yourself so you can more effectively care for others. Wellness truly does start with you. When you get involved in First Responder Wellness Week, I guarantee you'll be inspired to take better care of yourself and your brothers and sisters in public safety. Folks, we've got to be committed to making a change for the better. Keep your eyes open to how the job may be affecting you and those around you. Take steps to prioritize your wellness so you can better serve your community, your colleagues, and your family. Together, we can change the story. Please join in the conversation about wellness this week and throughout the year. Visit firstresponderwellnessweek.com to learn more. I hope to see you there. Gordon Graham, signing off.
And we are back, and thank you to the co-founder of Lexapol, the very well-known great Gordon Graham there, talking about First Responder Wellness Week. And as Gordon just said, it's firstresponderwellnessweek.com, and it's not just for the year. That website is full of resource videos, everything you need to keep yourselves healthy, motivated, fit, etc. is there all year round. So visit firstresponderwellnessweek.com any week of the year, and that information is there. Before I bring Dan back in, don't forget, please make sure that you like and subscribe on the platform or channel that you get your podcast from. Don't forget, we're on YouTube, so not only can you hear us, you can also see us. And so if you're listening, go to YouTube and watch us. If you're watching us, go to Apple Podcast and listen to us. Who says there's no choice these days? So talking to Dr. Dan Patterson from The Pit, and what a great show that's turning into. Obviously, we want to talk about, Dan, in the second half, really start to talk to our providers, start to talk to our agencies, start to talk to our chiefs out there, and a sort of series of questions for you, really. You know, the impact of sleep on well-being. You've talked about the lab conditions, but when you finish your shift, you've got to go home and sleep. You can't not just carrying on, right?
That's a hard thing to try to implement. Some people have a difficult time sleeping during the day. You know, a lot of my concern are people who do night shifts. Night shifts are very, very challenging, physiologically, not just cognitively, and has an impact on your mood, but it also has a huge negative impact on our physiology. So trying to sleep during the day for some people, when they're rotating, especially when they're rotating and they're not in a pattern of sleeping during the day and being awake at night, it can be very, very difficult. A lot of disrupted sleep, a lot of shortened sleep periods. And so that can just have an overall negative effect on their overall health. So trying to sleep during the day is challenging. I don't care if you're a regular night shift worker or one who rotates. And again, you know, talking about rotation, the slower the rotation, the better. So if we rotate from days to nights, the longer we can drag that rotation period out, the better it is, because they need time to adapt. And but yeah, sleeping during the daylight is challenging, no matter who you are.
So that almost sounds like if somebody loses the shift bid and goes from a day to a night, it's almost like being jet lagged for the first few weeks of the new shift. Then I'm imagining that's probably what it feels like. I certainly had that experience myself, where now the environment is different. So moving on, we get home, we've finished our 12 hours or however many hours it is, even, you know, and we can talk about shift lengths, etc. But, you know, even if you're on a 24 now, because the nature of EMS, that 24 is probably on the go non-stop. So even more fatigued than if you're doing a 12. But when you do get home, it's time to go to sleep. You know you need to go to sleep. What can we do to actually enhance the quality of that sleep and make sure that we do actually nod off?
Good question. So blackout curtains, I'm sure that many folks have heard of those. Implement some blackout curtains. The room temperature, try to get it cooler. So think about like between 64 and 68 degrees Fahrenheit. You can go to sleep quicker and stay asleep longer when you're in a cooler room. Some people need to disrupt the background noise that's occurring outside. You know, there's a lot of noise outside. Some people to use noise machines, like white noise machines or green noise machines, depending on what you favor, if you actually use one of those. And there are a number of other things that people have probably tried or heard about, you know, lavender smell, whatever works for you, really. But some key common tools that people use: cooler rooms, blackout curtains, and try to eliminate as much outside noise or disrupting events as possible, so that if you go to sleep, you can stay asleep as long as you can. So try to eliminate people coming in the room, being disrupted. Turn your phone off. You know, try to eliminate some of those external noises as best you can.
Certainly seen many houses, you know, first responder on nights sign on the door during the daytime. But something you said there really intrigues me, of course. You know, we want to eliminate noise, but, and it happens in this house. We have the sound of the sea, or there's a blue whale swimming past on the, you know, so what's the difference in having outside noise and then there's something that's, you know, playing by the bedside? Even phones now, you can get apps for this sort of stuff. So
Yeah.
what's the difference?
Well, I mean, that's a challenging question to answer. When you sleep during the day, you're more likely to be more in light sleep. And if you're in light sleep, it's a lot easier. So stage 2 sleep, for example, stage 1, stage 2, it's a lot easier to be woken up. It's more difficult to be woken up out of stage 3, stage 4 sleep, which is deeper sleep. But one thing that people probably don't know much about are the cycles of sleep. We get most of our deeper sleep, stage 3, stage 4 sleep, in that first hour and a half when we go to bed. And the amount of deep sleep that we get sort of shortens or dissipates the longer we are asleep. So we're in lighter sleep towards the end of our sleep episode, whether your episode is 6 hours, 7 hours, 8 hours, whatever. So it's going to be easier to be woken up out of sleep towards the end of your sleep episode. Well, if it's daylight, the world doesn't stop turning. There's a lot of activity outside. It's going to be easier for that outside noise to disrupt you and wake you from that lighter sleep, right? So the point is, if you can disrupt loud noises or interruptions of people coming in and out of your sleep room, for example, your bedroom, you're more likely to stay asleep, and even though you're in a lighter sleep. That the white noise, the green noise, what have you, there's some studies out there on that. I'm not expert in that area. I just know that that noise from the previous research has been shown for many, not everybody,
Hmm.
but for many to help them sort of drown out whatever's going on outside of the sleep room to help them maintain some level of sleep, whether it be light sleep or deep sleep. So it really is just mainly to sort of drown out what's going on outside.
A friend of mine was career Navy for years, great grey Navy, and he said that he couldn't sleep unless there was a generator somewhere, because what that
Mm.
meant was that the ship was working. When there was silence, it meant the ship was broken. And it's sort of interesting. But the other one that kind of confounds sleep as well is, and we're guilty of it in this house, right? So, I'm just going to watch 5 minutes of YouTube before bed. I've just got to watch, the football or the soccer, or just to see, I just got to watch that last bit of the news, upside down with the phone sort of above your head, which inevitably drops on your nose eventually, right? Not a good idea, is it? Or is it? You never know.
Well, here's one thing for certain. If you are awake for 24 hours, for example, you're in a long duration shift, the sleep pressure builds, right? And so one of the reasons why you drop the phone on your nose as you're looking at it is because you're going in and out of those light sleep episodes because the sleep pressure is pretty high and is going to cause you to go into that immediate sleep latency period of or that stage 1, stage 2 sleep where you just kind of nod off, right? Um, so if you have a lot of sleep pressure, it may be that the phone drops, it hits you in the face, and you stay asleep for a little while. So some people can watch TV, they can watch their phone and probably fall asleep pretty quickly. And the main reason behind that is because they have built up a huge amount of sleep pressure, sleep debt, right?
Right.
Which will cause them to go to sleep pretty quickly when laying down or in a restful state. But in normal conditions, watching the phone, watching the TV for most people is going to keep them awake longer. So you're basically losing out on the window of opportunity that you get to get as much sleep as you can.
So, guilty as charged here. I also have a smartphone that gives me scores on each element of my sleep state. We come down in the morning. What was your sleep score? Here's my sleep score. What was your REM, etc. It's almost ruining my life, but actually, it's something that now encourages us to sleep, despite the fact we have to watch the YouTube before we start. So, we've talked about the sleeping conditions. We've talked about distractions. I've just got off shift. It's 8 o'clock. Oh, I'm just going to have a couple of beers before bed.
Ooh.
Discuss.
Well, the alcohol may help you go to sleep, right? But there's literature that shows that it can cause disruptions in sleep. So it's not something that's really good for keeping you asleep. You'll wake up frequently, essentially. So it may be something that people use on a regular basis to get them to sleep because it's a habit, for example. But in general, the literature shows that it's not something that's going to help keep you asleep. And what we all want, is when we go to sleep to have a full, restful period of sleep and to avoid as many disruptions as possible. The outside noise can disrupt our sleep. Sleeping at different times of day, not in a regular pattern, can disrupt our sleep. Alcohol can disrupt our sleep. Having caffeine too close to bedtime can disrupt our sleep. So it's just one of those things that can lead to disrupted sleep. And you want to try to limit or mitigate disrupted sleep as much as possible so that when you do or when you are required to function, you can function, because those long periods of a full cycle of long periods of sleep, 6, 7, 8 hours, is going to be what gives you the energy to maintain, what you need to maintain in terms of your vigilance.
Excellent. You used the C word there, Dan, so I'm going to pick you up on it. You said caffeine. Let me just flip the script for a second. Obviously, we've spent this segment talking about how to get good night's sleep. But if you are on the truck and it is 2 o'clock in the morning, stimulants to actually keep us going until the end of shift, caffeine is in or out these days?
Definitely in. But what's really interesting is I've come across a lot of younger EMS clinicians, newly minted out of their education program, who have told me, who have actually participated in some of my studies, who are these newly minted paramedics, I don't drink caffeine, and I'm surprised. Like I'm really surprised, because they probably don't realize that some of the drinks that they consume actually contain caffeine. Number one.
Right.
Number two, just give them a year. Give them a year as working as a medic or an EMT, and they're probably going to have to start drinking caffeine because of all the disruptions in their sleep associated with shift work patterns of night, day, rotating, etc. And inevitably, many of them will start to drink some sort of energy drink or caffeinated beverage. But just in general, caffeine is it's the most widely used drug there is in the world. Okay.
There you go. You heard it here first. So you don't think about it, but it's true, right? Yeah.
It is true. 85% of shift workers, according to the recent literature, drink caffeine, average like 1.5 to 2 drinks a shift, for example. And most EMS clinicians who I encounter through our research report drinking caffeinated beverages on duty. So if you are at that critical time point during a shift and you are not allowed or permitted to get a nap, for example, then drinking a caffeinated beverage can definitely be helpful. Now, when to drink it is up to you. If you feel like you are overwhelmed with fatigue and you need a pick-me-up, yes, but have this in mind. On average, it takes 30 minutes to metabolize, so it's not going to be an immediate effect, right? And then also have in mind that the effect of elevated vigilance or alertness can last up to 6 hours. The half-life of caffeine is between 5 and 6 hours. So you just got to kind of keep that in mind. And it also depends on how acclimated you are to the amount that you drink. I drink a lot of caffeine. I have a lot of coffee, and I, over the years, have become acclimated to that. If you are not familiar with or used to drinking multiple beverages of caffeine, just be cautious, because it can have a negative effect on you in terms of cardiac effects. So palpitations, rapid heart rate. You don't want those to sort of surprise you, right?
Full disclosure, I think I'm totally acclimated to caffeine, and my family look at me like he's having a coffee and it's 10 o'clock at night. Doesn't affect me at all, apparently, and my sleep score supports that. So you talked about caffeine, obviously, and we'll go out where we came in, of course. Tactical napping, as I call it. Organizations should encourage and not punish folk that need to have a nap, particularly when they're on shift either in the station, in the truck. It's a thing that actually keeps us ticking over. And I think you covered that, but to sort of just talk about the art of napping and how long is a nap versus a cheeky sleep, as it were.
Well, the evidence is clear. Napping on duty for shift workers is helpful. It's helpful for their mood, so their sleepiness and fatigue can go down. It can be mitigated. It's helpful for their performance, and it helps their physiology. So we've shown in our lab, and we've published on this, and others have published on it as well, but we've done more of it recently, specifically to our cardiovascular physiology. Our blood pressure, in particular, is one indicator of cardiovascular health, right? Heart rate variability, arterial stiffness, all those are indicators as well. We use numerous indicators of cardiovascular health. We've focused a lot on how shift work has a negative effect on our blood pressure patterns. Typically, it's elevated during the daylight when we're awake, and it's lower during the night or during sleep. When we keep ourselves awake, or when we go through shift work cycles, our blood pressure patterns are completely disrupted. and they show this pattern of blunting, meaning it stays in an elevated state and it doesn't get the opportunity to dip. We call that the nighttime dip or the sleep-related dip. And what we can see with napping, strategic napping, even naps of 30 minutes, is that we can restore that normal pattern, even if briefly. And why is that important? Blunting of the blood pressure dip is directly associated with cardiovascular disease. So you can think of this: if I go through shift work and I'm not allowed to nap. I don't know, Rob, have you worked at an EMS agency where you're not allowed to nap? I have. And I can tell you that it's probably one of the most miserable experiences I've ever had as an EMS clinician, where basically it was against the rules to nap. And I can tell you that, again, the physiology behind this of napping, in particular, the health benefits are very significant. So when we nap on duty, even just for 30 minutes, we give our cardiovascular system a moment to rest, and we can restore that normal dip, even if briefly, and restore some normality to our cardiovascular health. So that's a physiological benefit. Not only is there benefits to our performance and our mood, but physiologically we can improve our health through napping. And timing, EMS is chaotic, right? The duration of nap, good question. So 30 minutes, we can get that, for many of us, we can get that restoration of normal dipping in our blood pressure. But when we go beyond 30 minutes and we go into that between 30 minutes and 90-minute range, we are a little bit elevated in terms of our risk of sleep inertia, that groggy feeling when we wake up, and that's associated with deeper sleep. And we've seen through our EEG data that when we go past 30 minutes, we get into 45 minutes or 60 minutes, we definitely go into that deeper stage of sleep. And when I wake you up from deeper stages of sleep, and I've had that happen on duty, I'm sure many people have, you are just overwhelmed with that grogginess, right? And it can take a little bit longer to get going. So the data bear that out, right? So if I was an EMS agency operations chief or director and I was in charge of fatigue mitigation policies or sleep health policies, I would definitely adopt a policy that says, okay, short naps, we welcome those. Longer duration naps, if allowed and the opportunity presents itself, great, but you also need to be aware of the risk. You may experience a little bit more sleep inertia when waking, and it may be a good thing to have a partner stay awake while you're sleeping. For example, it may be a good idea for the person who's more vigilant when dispatched to be the driver, and you be the passenger for 10 minutes until you can come over that sleep inertia. It takes about 10 to 15 minutes to overcome that sleep inertia for most people. So if you're just aware of that risk between that 30-minute and 90-minute range, you can strategically place naps so that you sort of mitigate the risk, but also gain benefit, physiologically, specifically cardiovascular wise.
That's excellent. And actually, so in this half, we've covered the whole how to rest when you need to rest, how to remain alert when you're on duty, and indeed how to stay fresh through strategic and tactical napping. So that's all excellent stuff, Dan. So before we go, if you are talking to a room full of EMS chiefs out there today, what would your message to them be?
Well, specifically on napping?
Yeah. Or on the whole sleep fatigue and, getting the best out of the workforce, but also having them ready to go home and live their lives as they should do when the shift is over.
So sleep health is vitally important. It affects so much of who we are, our wellness, our mood, our performance. So promoting that your crews get as much sleep as possible is a good thing, because in many cases, between 30 and 40% of your crews work more than one job. And so that means that their lifestyles are very chaotic. That means they're probably not paying very much attention to their health and their wellness, and they're going to burn out at some point, right? And we want to keep them around us for as long as possible. So promoting that your crews get as much sleep as possible on their downtime is a good thing, because it will allow them to be happier. They'll have less sleepiness, less fatigue. Their physiology, their cardiac physiology will be improved, and their performance will be better, right? So in terms of napping, if you don't yet have a napping policy, I would encourage you to consider one. And an easy solution here is let folks nap just briefly, even for 30 minutes. You can avoid the sleep inertia issue if you're concerned about that. You can probably avoid some of the potential stigma because a lot of folks are worried about the stigma of people sleeping on duty. But adopt these during night shifts, adopt these policies for night shift workers in particular, and long duration shift workers. So you can avoid that, if you keep those naps really brief. But you can also gain some physiological benefits from that. And your crews will probably, if you make them aware of these benefits, will probably thank you. So you can gain a lot of goodwill, if you will, from your crews. If you don't have yet a policy or you don't yet promote napping, do so, because it can have both health benefits, performance, mood, and longevity benefits for your crew members. And the last thing I will mention is regularity. Regularity in your sleep is a really difficult thing for shift workers to do because of how chaotic their shifts are, rotating shifts. Maybe they work more than one job, for example. But if we promote greater regularity in their sleep, as much as they can implement, they're going to do themselves a great favor in terms of their health and well-being. Because there's a recent research out there from the UK, for example, Rob, that shows that the less regular your sleep, the greater risk you have for a lot of different chronic conditions and even death. So the more regular you can make your sleep habits, as best as you can make it regular, the healthier you will be.
So public safety isn't a job, some say, it's a way of life. But in order to continue to live that life, you've got to be very sensible and very deliberate about your rest policy, your sleep policy. Organizations, I'm going to name it now, need to have the night shift assistance policy, the NAP policy. Let's do that. Dan, thank you. Also, one of the things you mentioned before I go, I'm just going to pick up on one word that you said there and use the word burnout. And spoiler alert, the 2025 What Paramedics Want survey that's about to come out is going to focus majorly on burnout, because that was a category that was added to the question set. And it's in there and it's very, very real. So thank you for using that word. It segues nicely into the What Paramedics Want work that's going to emerge very, very soon, Dan. So you hit the nail on the head there. So thank you. But for the moment, Dan, thank you very much for joining us. And I hope that you have a very good night's sleep tonight. That was Dr. Dan Patterson talking about sleep, what you should do, what you should know, how you can get the rest that you need, the things that you need to do to make sure that you get good rest if you're on duty, the use of caffeine, the use of the tactical nap. Yes, it is a thing, as you heard Dan talk about. So, whatever situation, scenario you're in, on duty, off duty, make sure you're doing those things to stay healthy. So this was the EMS One-Stop First Responder Wellness Week edition. All the resources that we talked about are in the show notes, including the link to the First Responder Wellness Week page. So that was it. Now we're going to go off and have a snooze and a tactical nap. Thank you to my guest, Dan Patterson. I've been Rob Lawrence. And until next time, bye for now.